morning, everyone. Well, I think you're going to hear from me some similarities to the presentations of George and Cindy. We operate in a very different industry, and I'll give you a little bit of background above us, and then take you through some of the steps that we have taken to onboard our executives. Since everyone's doing a little bit of storytelling here, I think that I will start that way as well. And I'll give you one of our failures, if you will, where we brought on a change agent, and I would say we did almost none of the things that were recommended here this morning. And guess what? This person is no longer with us. And it was one of the few times where we had hired an executive and it didn't work. He was brought in view of the changing healthcare environment to really help us look at the future, to bring in a new line of business. And what he found was an organization and a senior team that was basically saying, prove to me first that you know how to do this before I will accept you. And we learned a lot from this situation. Another motivator for our onboarding process was the whole healthcare environment. If any of you here are in healthcare, anyone? Okay, few. It's been a very complex and changing world. If we go back about 5 years ago, there were all kinds of shortages of nurses and physical therapists. Each hospital in the city, home healthcare organization, community-based organization was fighting for the same staff. And in home healthcare, the business that we're in, the only thing between success in an organization is the number of staff that the organization has. Things today feel a little bit different. In healthcare, staff aren't moving around as much. Even though everyone says it's a down economy, it's still hard to find high performers, and when you recruit them, you want to keep them. So our onboarding process really started about 5 years ago, driven by the two examples that I've given you. One, the executive who just didn't make it, and two, the situation where we really had to stay ahead of the game in terms of recruiting and retaining staff. And we spent a lot of time working with staff within the organization at all levels to think about a process. And our OD department spent significant time doing focus groups and interviewing leadership to find out what they thought would work at our organization. We use a model that I'll talk to you about, and I'll lay out some of the steps. But we really thought it was key to gain buy-in, because I think it's already been mentioned, and it's still a struggle for us at times. How do you get leadership to follow the recommended process? And I agree with Cindy's advice. It's really key sometimes for HR to step out. This isn't something where you're telling your business what to do in terms of their business, but it's a process, and it's been shown over and over again. And interestingly, we partnered with our research department, and actually Scott, who's in our OD department, who's here today with Andrew Wise, they actually took a look at the data we had, at people who came on board with an onboarding buddy, as we call them, as compared to those who do not. And there was a statistically significant difference that our research department verified for us among those that had onboarding buddies and those that did not. So I'm going to step you through some of the slides that I have here, not word by word, but give you an idea in a concrete, specific way how we do onboarding at VNS-NY. So just for those of you who don't know who we are a home and community-based organization. We provide home health care to people in their homes and the community. We have over 14,000 employees with about 2,500 nurses, 500 rehabilitation therapists, and 600 social workers. and about 8,400 home health aides. A portion of our organization is unionized. The nurses are unionized by the United Federation of Teachers. That sounds funny, but it's true, and it's not a mistake. And our clericals and escort staff are organized by the 1199 here in New York City. Some of you might be saying, is there a difference? Is this a plan for a union shop, a non-union shop? We've worked hard to develop a collaborative relationship with our union. I don't really see any difference. We have parts of the organization that are unionized and parts that aren't. It's really the same messages and themes that you've heard here. If one thing is different, though, we have found it important to really think about coaching our leadership that it's really no different. Yes, there might be more grievance procedures. You might have to go through a few more steps. It's not our culture to walk people out the door rapidly, but in terms of onboarding an executive, if anything, it becomes a little bit more important if someone has come from a non-union shop to an organization with a union. But the steps are really the same. We care for about 130,000 patients in the New York metro area. We certainly see during the course of a week more individuals than any hospital in our community sees. And since we are a not-for-profit, we give back to the community in charitable care. On the next slide, I'm not going to spend a lot of time on this, but you can see our range of services that begin with the pregnant mom and end at end of life. A good part of our business is around acute care with people who have been discharged from the hospital with surgery or perhaps a chronic disease. And we've also recently become an insurer, so we have a Medicare Advantage plan as one example of that. You see on page 4, while this chart, frankly, was very simplified, we really are a complex organization. Within each of these lines of business, there are many programs and services. And when we meet people that don't know us, or even search firms that don't know us well, when they start delving into the organization, they see how really complex we are, which makes it complicated for new hires. And change was mentioned by Cindy. That was her topic. I mean, we are constantly in healthcare facing change. We're facing federal budget cuts. We're facing state budget cuts, even though federal legislation looks at providing additional health care to individuals. There are cuts that are taking place in other parts of the business. Hospitals are facing significant cuts. Home care is facing significant cuts in terms of billions of dollars over the next 10 years. This is coupled with the state and federal governments looking at health care reform and a new service delivery system for health care. So every executive that we bring in is key to the organization and to making change happen, as well as running the organization at the same time. So we've been using a model that we call join, pace, and lead. Join sounds like what it is, and up through day 1, we call it pre-boarding, and this is the hiring process. Pace, let's get to learn the organization, let's learn which people are important, let's learn the processes, the procedures, and the policies. And by lead, the individual is assimilated within the organization. If you look at page 6, this is our timeline. These are the key steps. I won't read them each out loud to you. We'll go through a few of them in the few minutes that we have. But this is our overarching plan or timeline. The big aha that we had about 4 or 5 years ago, and it's probably not such an aha, is that it was really important that we move from a one-day orientation and an ad hoc orientation of a few weeks to what we deemed a one-year integration period. And we looked at our data, and I'm sure if all of you look at your data, you will see that you lose the most people during the first 6 months of employment. For us, it's probably within the first 4 months of employment, but we decided to really build out a plan for the first year to fully integrate someone, and that's the language we use rather than orientation these days. If you move on to page 7, we've highlighted for you some of the key tools that we use. We have an electronic onboarding system, which we built. We looked around at a lot of different ones. We found one that we could afford, and we're really very proud of it. It's fully electronic. It welcomes individuals to our organization. No more paper induction, a word I hated when I came to the organization, inducting employees. So now we